Hello, I'm Ella. I'm a student in the Physical Therapist Assistant Transfer Program. And for today's lab, I have my boyfriend Matthew with me, who's going to perform the lifts for me today because I physically am unable to. So Matthew, I will have you perform first a deep squat, okay? So I'm going to have you wider stance, about shoulder width apart here. Good. A good base of support, okay? I'm going to have you just push your hips back for me. Squat down, and I want your hips below the knees, okay? So go ahead and squat down for me. Grab that box, keep a nice tight core. Go ahead and lift up. Good, excellent. Go ahead and same principles, lift back down. Good. Next one we're gonna do is the power lift, okay? Similar here. You can be a little bit behind the box now, okay? Same stance for me this time, okay? This time I want your hips above the knees, okay? So I don't need you to get super deep this time. Okay, so go ahead and squat down for me. Good, and right back up. Good. Same principles, right back down. Good. And then we'll come over here for the straight leg, okay? So this time you can imagine as if you're lifting something out of the back of your car, okay? So staggered stance for me, one in front of the other, okay? And then you're gonna go ahead and come down for me, keeping those legs straight, good, and right back up. Perfect. Okay, next one we're gonna do is the one leg stance or the golfer's stance, okay? So this one you can imagine as if you're picking a golf ball out of the hole, okay? So you're gonna keep that back leg straight for me. Okay, front foot, okay, is gonna be kind of bent. I want you to come down, lift up that back, and same principles, right back down. Excellent. Next one we're gonna do is the half kneeling, okay? So I'll have you lift the box. Go ahead and lunge down for me, one leg in front of the other. Perfect. This time I want you to bring that box closer to you. Good. And then you're gonna lift that box up, put it on your left thigh for me. Good, and then go ahead and lift through that heel, come forward. Perfect. And then same principles, right back down. Excellent. Good. Next one is traditional. Okay, so this one you can be kind of parallel with the sides of those blocks. Okay, good. And then this time I want your knees and your hips to be kind of equal here, okay? Keep a nice neutral spine and make sure you're breathing through the lift. So go ahead and squat down for me. Good, and right back up. Perfect. And down. Good. Next one is your stoop stance. Okay, so we're going to use this bag here, okay? So stoop stance, good, side, and you can kind of have that staggered stance again here, okay? And I want you to go ahead and lift down for me. Go ahead and that front foot, yep, you can keep that hand as that base of support and go ahead and lift up for me and right back down. Hi Matthew, I'm Ella. I'm a physical therapist assistant student over at Clarkson College, and I'll be the one helping you today, okay? All right, so we're going to go ahead and get you into a few different positions today. The first one is called supine, okay? So supine is laying flat on your back, okay? So I'll go ahead and have your head here. Go ahead and lay flat on your back for me. Excellent. And then I'm going to go ahead and add a few extra pillows just for added comfortability for you, okay?
Okay.
All right. I'm going to go ahead and lift this leg up. Is it okay if I touch you? Perfect. All right, Matthew, you feel comfortable there?
Yeah.
Perfect. I'm going to add one more underneath your right leg, okay? Go ahead and lift up. Perfect. All right, Matthew, do you feel comfortable here? Perfect. So this is what the supine position would look like. The next position is called prone. Okay, so prone is we're going to have you flip over and this time laying on your tummy, okay? So I'm going to go ahead and remove these pillows first for you, okay?
Okay.
Lift up here. And lift here. Perfect. All right, Matthew. I'll go ahead and have you flip onto your tummy, okay? So you can flip towards me.
Okay.
Perfect. Excellent. Good. And I want this pillow kind of near your forehead, kind of on where your head is, okay? You feel comfortable there?
Yeah.
Good. I'm going to add a few towels in front of your shoulder, and then a pillow underneath your tummy, and then underneath your ankles here, okay? All right, Matthew, I'll go ahead and have you lift those hips up for me just a little bit. Perfect. All right, go ahead and lower for me. Feel comfortable there, Matthew?
Yep.
Excellent. And I'm going to go ahead and lift up these legs here for me. Perfect. Excellent. And I'm going to go ahead and grab some towels for you. Okay, so this towel is going to go under the front portion of your shoulder here, okay, that anterior aspect of your shoulder. Lower. Perfect. And this next one here. Excellent, Matthew. Do you feel comfortable there?
Yep.
Good. Good, so this is how we would put a position or a patient in the prone position. Okay, Matthew, the next one we're gonna do is the side lying position, okay? So I'll have you lay on your right side. First, I'm gonna remove all the pillows and towels from you, okay?
Okay.
All right. Thank you. This one from you. Go ahead and lower for me. Perfect. And one more time for me, Matthew. Go ahead and lift from here. Perfect. Excellent. Good. Okay, Matthew. So now we're gonna lay on your side here for you. Okay, you're gonna be laying on your right side today. Okay. So I'll have you go ahead and move your hips towards me. Use that arm for base of support for you. Good. Excellent. So I'm gonna go ahead and fold this pillow up for you so you're just a little bit more comfortable here. Good. Knees on top of knees. Perfect. Excellent. All right, Matthew, I'm going to go ahead and give you this pillow to hold on to. Excellent. All right, and I'm going to add this pillow in between your knees for you, okay? So, all right, go ahead and lift for me. Go ahead and lower. Excellent. And I am going to place one towel proximal to the lateral malleolus. Good, so what that means is I'm going to place it under your right leg here, just above that ankle joint, okay?
Okay.
Good. Matthew, are you feeling pretty comfortable here?
Yep.
Excellent, good. So this is what the sideline position would look like. Good, so I'm going to go ahead and remove everything from you now. After this, I want you to go ahead and we're going to sit up, okay? And I'm going to put you into the seated position, okay? All right, so I'm going to remove this towel from you. Good. Now take this pillow. Perfect. Go ahead and take this pillow from you. Perfect. And Matthew, you can swing your legs in front here and go ahead and sit up. And have you sit down for me? Excellent, good. So I would say you're a pretty good position here with a 90-degree angle. Your feet are flat on the floor. Good. And I would say, since you're a bit taller, I'm going to add 2 pillows here, okay? So I want you to go ahead and lean slightly forward for me. Good, and into those pillows here, okay?
Okay.
You feel comfortable there?
Yeah.
Good, okay. This is what I would do for a seated position to have them probably closer to the table. And probably this one has a bit of a wall, but I would probably move them closer to the table. The next exercises we're going to be doing is PROM, or passive range of motion. Okay, and what passive range of motion is if my patient were unable to perform any active exercises, me, the PTA student, would be moving their joints through that specific movement. Hi Matthew, my name is Ella and I'm a PTA student over at Clarkson College and I'll be working with you today. I'm going to go ahead and move your joints through a few passive range of motion exercises. We're going to be working through your shoulder and your hip joint today, okay?
Okay.
Excellent. So I'll go ahead and have you lay in a supine position or flat on your back for me. Excellent. Perfect. Okay. So we're going to be working with your left shoulder here today, okay? We're going to be working first through the glenohumeral joint or the shoulder joint. Okay, so I'm going to go ahead and Matthew actually have you scooch a little closer to the edge of the table for me. Perfect. First movement we're going to perform is flexion and extension. Okay? Perfect. So I'm going to go ahead and just have you relax for me, okay? Perfect. First one we're going to perform is flexion, okay? So what that's going to look like, I'm going to bring your hand over your head here, okay? So I'm going to go ahead and relax again. Good. I'm going to bring you over here. Perfect. Feel comfortable there? Excellent. I'm going to go ahead and extend you back down here for extension. Excellent. Good. Feeling good. Next one we're going to perform is abduction and adduction. Okay, so abduction looks, I'm going to take here, and we're going to go ahead and I'm going to move you out away from your body. Okay?
Okay.
Okay. All right. So this is abduction or abduction, moving your arm away from your midline or the center of your body. Okay, good. So again, abduction, and then I'm going to adduct you right back in, putting that arm back to your side, okay? That feel okay? Excellent. The next movement we're going to perform, okay, is going to be external and internal rotation, okay?
Okay.
So I'm going to go ahead and abduct your shoulder here. Perfect. Relax for me. Good. So what I'm going to do is I'm going to bring your wrist down for external rotation here, okay? All right, so again, relax. I'm going to go ahead and externally rotate you. Excellent. Good. And then the next one I'm gonna perform is gonna be internal rotation, okay? So this time I'm gonna move your wrist down, okay? Good, so go ahead and relax for me. Good, excellent. Feeling okay? Perfect, okay. For the glenohumeral joint or your shoulder joint, okay, I would be testing bilaterally, okay, because the affected side versus the non-affected side usually can feel a difference there, and we're looking for a soft, firm, or hard end feel, okay? The next movement we're gonna move into is through your hip joint, okay, or your acetabular femoral joint, okay? So the first exercise I'm gonna perform is flexion of your hip without any knee flexion here, okay? So I am gonna lift your legs straight up, okay? Okay, so go ahead and relax for me. Good, I'm gonna bring you straight up here. This is flexion of your hip without any knee flexion. Keep breathing for me. And I'm gonna extend you right back down here, okay? That feel okay, Matthew?
Yeah.
Perfect. Good. Next exercise, we are gonna do flexion and extension of your hip, this time with a knee flexion, okay? So I am gonna grab here and I'm going to bring your knee up similar towards your chest, okay? Perfect. Good, so I'm gonna go ahead and raise your knee here to about a 90-degree angle. Good, so I'm gonna go ahead and flex that hip joint. Feeling comfortable still? Good, keep breathing for me. Good, and I'm gonna extend you right back down. Excellent, good. The next exercise we're gonna perform is abduction and adduction of your hip, okay? Good, so I'll go ahead and have you actually just comfortable there, right there. Perfect, so I'm gonna go ahead and similar to your shoulder joint, this time we are going to take your leg and I'm going to abduct it or move it away from your body, okay?
Okay.
All right, so I'm gonna grab here. I'm gonna go ahead and abduct that hip for you. Feeling comfortable there? Good, keep breathing for me. And adduct you, or adduction, I'm gonna bring you right back into neutral, okay? The next exercise we're gonna perform is internal and external rotation of your hip, okay? So similar to that flexion extension where your knee was extended, okay, I'm gonna bring you up in that same position. This time I'm going to internally rotate your hip, okay? And what that means is I'm going to take your knee and I'm gonna rotate it towards that right shoulder, okay?
Okay.
All right, you ready?
Yep.
All right. Good. Okay, so I'm gonna extend here. Good. Flex into here. Good, again, so internal rotation. I am gonna rotate you in here towards that right shoulder. Feel comfortable?
Yep.
Keep breathing for me. Good, and then external rotation, I'm gonna bring you towards that left shoulder now, okay?
Okay.
Good. Excellent. Feel comfortable? I'm gonna go ahead and bring you back down. Good, and again, we're looking for that soft, firm, or hard end field here. And then I would test bilaterally or his right side just to see and compare. Okay, Matthew, excellent, thank you. I'm gonna go ahead and have you sit up here, okay?
Okay.
The next passive range of motion exercise I'm gonna do, okay, is gonna be similar to your supine internal and external rotation. Okay, now we're gonna be seated, okay? So first, I want you to go ahead and fix that posture for me, keep that core tight, and just keep breathing through the motion. Keep a nice neutral spine for me, okay? Good, so again, I'm gonna do internal rotation here. So bring that ankle in here. And then I'm gonna move it right back out. Okay? Excellent. Thank you for your help.